Republican Party is the selfish party. These people don't care one iota about humanity. But what about the other 33 million people that need health care in this country?
No benefits for non-citizens. If you're not a citizen, get out.
It's absolutely a problem, but we're attacking that problem, finally, after 100 years of nothing.
So for 100 years, if this wasn't a problem, why all of a sudden is it a problem now?
It has been a problem for 100 years. No one's done anything about it.
Why haven't the Democrats done something about it?
They've tried.
Over the years, we had Bill Clinton.
We've tried, yeah, and guess what?
Clinton.
And what did the Republicans do?
No,
They smashed it, like they love to smash and squash anything they don't agree with.
Hillary Clinton was given the responsibility as the first lady.
Yeah, and they smashed it because the Republicans just dislike her so much. Why? I have no clue.
No, they didn't dislike her. They thought her solutions
politics.
and ideas were impractical.
It was all politics and had nothing to do what was good for the American people. As a matter of fact, even your friendly Republicans proposed something in '96, some sort of health care reform bill that they wanted, and it actually mirrors a little bit. Some of those suggestions have been put in this same bill that they now are fighting tooth and nail, that they're going to say repeal and replace, repeal and replace.
The ridiculousness of this whole medical attempt to solve that problem is clearly have been shown to be useless, because the law itself has to be modified in order to be meaningful.
That's not
I never heard of any such
Oh
thing.
my God, they're constantly making amendments to laws all the time.
Not
Absolutely,
the next
because
day.
when you pass a law, there's always going to be some sort of loophole, something that you didn't see.
Your boss says to you, I want to report
my God.
on your last trip. You come in, you say, here's the report, but I'm going to write the corrections tomorrow.
Yeah, that happens all the time.
Really?
Oh yeah.
Well, you should be fired.
Oh, why? Everything needs tweaking. Even when you don't think it needs tweaking, it needs tweaking.
Before you submit it.
No, after you submit it. And you always want a second set of eyes, a third set of eyes, a fourth set of eyes, because you don't always see things.
The Congress has been operating by writing laws, and the president signs or vetoes it after they finish. They don't sign the law and then change it the next day.
Excuse me, when you were working at, when you used to work as an engineer, didn't you give your secretary things to review after you had done it, because you wanted that second opinion, that layman's opinion?
Absolutely.
Well, there it is.
But
and it had to be tweaked and it had to be changed.
Before I signed it, it was correct and it was complete.
You signed it before, after, and in between.
I didn't send a report off to my boss and say, here's today's report. I'll fix it tomorrow.
But you're getting off point, because more importantly to you, isn't it your opinion that you don't think there's a problem with healthcare?
I don't think it's the major problem. No, I don't think
it's a huge problem.
National security is probably the most important problem.
We've dumped enough money in national security. Believe me, you wasted American tax dollars with this war and everything else. National security is just fine. It's time to focus on healthcare in this country.
I'm talking about our security.
It's a killer.
Here in the United States.
If nothing was done, the United States was going to go bankrupt so fast it would make your head spin.
No, it wouldn't.
Yes.
No.
Yes.
You just
all the people agree to that. All the economists. All economists agree to it.
All the economists?
Yes,
personally?
I do. If you can believe it.
Come
No, come on. No, but Dad, no, really. Something had to be done with healthcare. The costs were spiraling out of absolute control.
Yes.
Insurance companies just raising premiums ad nauseum, just perversely, for no reason.
Some of the experts that worked on this program said they're going to find some money by getting rid of the fraud and waste. Now, if you did that, you could pay for the 26 or 30 million people who weren't covered already.
What are you talking about, fraud and waste?
26 million is like 8% of the people in this country that aren't covered.
What are you talking about? What fraud
and waste?
I don't
know. The Democratic Party, someone spoke for the Democratic Party and said that they're going to get a lot of money to cover this new plan, the new health care plan, by saving money from fraud and waste. It seems to me the first place you start is with fraud and waste, because if you get rid of that, you may not need to change the medical program.
No, yes, because There's discrimination there was discrimination in the laws. Insurance companies were discriminating. To me, one of the great things about this law, again, is pre-existing conditions. I'm sorry. They choose whether you're going to be insured or not based on a pre-existing condition. That is not right. And their focus is,
I agree.
You do agree with that?
I agree with that, yeah.
Because their focus is, bottom line, the less they have to pay out, the happy their shareholders are. For them, it's all about making money. It's not about saving lives. It's not about the quality of life and the health of the individual. It's about making money. And you've got to ring that in. I'm sorry, medicine should not be about making money.
No, but it shouldn't be about losing money either.
Right. Okay, that's fine too.
So you have to balance how much medical care you can provide for a given dollar. There's too much being charged for some medical services. I went for a cleaning, had my teeth cleaned a couple of months ago, and the bill was $900 for a deep pocket cleaning. Now, what I didn't realize is the dentist was cleaning my pocket and not my teeth.
Well, yeah, that's
and $900 for a cleaning is exorbitant.
Okay.
That guy should be out of business.
Okay, so should you say the government should step in and regulate how much someone can charge for a deep pocket cleaning?
No.
So what are you saying?
I think the answer to that is to always ask before you obtain a service. If you haven't work done on your car, get an estimate. If I had asked the dentist, how much is this cleaning going to cost me, and he said $900, I'd have been out of that office very quickly. Because my dentist, my personal dentist, who's not a periodontist expert or whatever he is, only charges me $130 for the same deep pocket cleaning.
Okay.
And that time he didn't clean my pants pocket.
Okay, that's fine. But, and actually you're mentioning something, dentistry. Now, your insurance didn't cover the deep pocket cleaning. Why not? Why didn't it cover? Why didn't it pay part of that cost? If you're paying
because dental plans, like any other plans, that's another issue. But anyway, they have a limit, $1,500 a year, $1,000 a year, whatever it is.
But why is that? How come only $1,000? Why shouldn't they cover $3,000?
Well, you can get more, but you need to pay a higher premium.
Yeah, a lot more. You might as well just keep the money yourself, because at one point the premium costs more than what it would cost you to get the work done on your teeth.
Well, no. My point is, and I don't want to get away from it, is that the dentist charged too much. $900 for a cleaning is too much.
And insurance companies hike their rates arbitrarily way too much.
Either that, or in this case, they refused to pay him that much money. So I ended up having to pay what the insurance didn't pay because he charged too much. So
again,
now,
insurance companies running our lives, telling doctors what they can and can't do. Yes, they do.
No, they
are the true death panels. Again, as our producer has
the limits,
said
but
a couple
you have
times.
to know what they are. For instance, if the doctor says you need a gallbladder removed, you should ask, how much is that going to cost?
If you need the gallbladder removed, you got to get the gallbladder removed. Period.
But there may be
the cost is irrelevant.
Who does it at a cheaper rate, or if within your medical
good point.
plan.
But guess what?
If you go to your PCP, he probably does it cheaper than some specialist.
And there you go. And that's why we need a government option, because right now insurance companies dictate it all. Private insurance, nobody to compete with them.
Well,
no one to compete with them. We need a government.
Government options don't work because a government
you don't know that. We haven't tried it yet. Let's try it.
We talked about this before. The post office is collapsing.
That's the post office.
After 200 years,
that's the post
office. It's over.
Apples and oranges.
The Federal
We're talking about
Communications
healthcare.
Commission has collapsed to the point where they don't control the profanity that you see on the air anymore. Years ago,
that shit needs to be controlled. Yes.
Many years ago, in the radio business, if you said words that were today considered totally innocuous, you could lose your job immediately. But today, TV stars show body parts on TV, and that's fine. They get away with it.
They don't get away with it.
The FCC is not doing their job. The post office doesn't do their job.
It's called a costume malfunction.
Social Security is broke. Medicare is going down the drain.
Social Security is not broke.